Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's 1 every 66 seconds. But here's the terrifying part. What if the cause isn't aging by your medicine cabinet? You've been told these pills are safe, routine, even essential. But new research is sounding the alarm. 99% of seniors have no idea that at least one medication they're taking could shrink key memory centers in the brain by over 28% in less than a year. Let that sink in. And the pharmaceutical industry, it is known about this for decades. Yet they profit billions from selling the same drugs that may be accelerating cognitive decline in millions of seniors. In fact, a 2023 study in Neurology and Aging Research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use. In this video, we'll reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly ignored to mind-destroying. And number 3, it's prescribed to millions for something harmless, but it can shrink key memory centers in your brain, and you probably don't even have a clue it's doing it. Before we dive in, let me know in the comments. What medications are you taking daily, and have you ever felt sudden brain fog or forgetfulness? We're reading every comment and replying with personalized insights. Don't stay silent. This could save your mind. Now, without any further ado, let's start at number 9. And don't let its position fool you. This one is in almost every senior's cabinet. It might be scrambling your brain before you even feel it happening. Number 9, diphenhydramine or Benadryl. Diphenhydramine is that pink pill millions trust to help them sleep, soothe allergies, or ease cold symptoms. It's cheap over the counter and you probably have it in your nightstand right now. You may think you're just taking it to sleep better or relieve allergies. But inside your brain, Benadryl can be disrupting the hippocampus, that is the region responsible for storing new memories. Benadryl is part of a group of drugs called anticholinergics, which block a neurotransmitter called acetylcholine. This is a chemical that helps your brain form new memories and stay alert. The older your brain gets, the more it relies on every bit of acetylcholine it has. And when this drug interferes with that process, the result can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared to those who did not. So, how can you protect your memory? First, avoid anything with diphenhydramine, especially if it's labeled PM, nighttime, or allergy relief. These are often just Benadryl in disguise, and if you're using diphenhydramine for allergies, there are newer non-sedating options like Loratine, which is commonly sold as Claritin, that do not cross the blood-brain barrier and are much safer for long-term use in seniors. Never stop a medication abruptly, but never assume that over-the-counter means safe. Up next is a drug often marketed as harmless and gentle on your stomach. Yet it can interfere with the very nutrients your brain needs to stay sharp. Number 8, proton pump inhibitors. Priloc or Nexium are medications that belong to the class called proton pump inhibitors or PPIs. These drugs are designed to reduce stomach acid and are often prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years, even decades, because their symptoms return as soon as they stop. But what's rarely discussed is how PPIs interfere with the absorption of vitamin B12, which is a crucial nutrient that protects the brain and supports memory, focus, and mood stability. In a study from 2016 published in JAMA Neurology, researchers examined over 73,000 people aged 75 and older and found that regular PP users had a 44% increased risk of developing dementia compared to non-users. By suppressing stomach acid too aggressively, PPIs interfere with the body's ability to absorb not just B12, but also magnesium and calcium, which are essential for neural transmission and brain cell signaling. Without them, neurons struggle to fire efficiently, which causes misfiring, confusion, and memory lapses that often mimic the early signs of Alzheimer's disease. But the issue goes even deeper. PPIs have also been shown to increase levels of amyloid beta plaques in the brain, which are toxic proteins that disrupt brain function and are considered a core driver of Alzheimer's disease. The good news is that there are safer alternatives. If you're using a PPI daily, ask your doctor whether you can taper off slowly with the help of H2 blockers like phosphatidine, which is sold under the name Pepcid. While not perfect, H2 blockers are less likely to interfere with cognition. Also, chewing a bit of deglycerinated licorice, which is a natural compound that coats and soothes the stomach lining, can offer symptom relief without cognitive harm. Next is a medication often taken for bladder control, but it may be wreaking havoc on both short-term memory and emotional balance. Number 7. Bladder control medications. Oxybutynin, which is sold under the brand name Ditropan, is often prescribed to seniors who struggle with urinary incontinence or overactive bladder. On the surface, it seems like a practical solution. No one wants to deal with the embarrassment or inconvenience of frequent bathroom trips. But this medication works by blocking acetylcholine, which is the same brain chemical disrupted by Benadryl. And unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and affects memory regions in the hippocampus directly. That makes it particularly dangerous for seniors, especially when used over long periods. In a 2019 study published in the BMJ, researchers found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That's nearly 1 in 2. What makes it more concerning is that many seniors are never warned about the cognitive side effects. They are simply told it will help with bladder control, not that it may accelerate mental decline. The harm is often mistaken for normal aging. Patients describe feeling foggy, forgetting appointments, misplacing items, or suddenly struggling to keep track of conversations. It's rarely linked back to the medication until the damage has progressed. So if you're taking oxybutynin and you've noticed any mental changes, it's not just in your head and you don't have to stay on the drug to stay in control. Fortunately, there are newer medications like mirbagrun, which is sold as Myrbetriq, that work through a different mechanism and have shown significantly less impact on memory. These drugs do not block acetylcholine and are generally considered safer for older adults. Number 6. Statins. Statins are among the most widely prescribed drugs in the world, especially for people over 60. They are meant to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and arovastatin, which are sold under the brand names Zocor and Lipitor, are the two most common ones. But here's where the problem starts. Cholesterol isn't just a heart issue. It's a brain necessity. The brain is made up of nearly 60% fat, and cholesterol plays a key role in creating and maintaining the myelin sheath, which is a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may also be starving the brain of what it needs to function. In a 2023 study published in Frontiers in Aging Neuroscience, seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. And those on high doses had even more noticeable declines. What's even more concerning is that some patients reported sudden onset memory loss, describing moments where they couldn't recall names, recent conversations, or even familiar driving routes. Now it's important to understand that not all statins affect the brain equally. Some, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are considered less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing fog, forgetfulness, or confusion, it might be time to talk with your doctor about a dose reduction or alternative strategy. Don't wait until it becomes irreversible. The earlier you take action, the better your chance of protecting your mind for the years to come. Number 5. Benzodiazepines, benzodiazepines, which include drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed medications for anxiety and sleep problems. They work by enhancing GABA, which is the brain's calming chemical that reduces overstimulation. At first, they seem like lifesavers. They quiet the mind, ease panic, and help with sleep. But over time, these drugs become something else entirely, a trap. A 2022 study published in the BMJ followed over 8,000 seniors over a 6-year period, and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk went even higher for long-acting benzo like diazepam, which stay in the body longer and accumulate in fatty tissues including the brain. What happens is a kind of chemical sedation that slows neural activity. That means your brain stops learning as quickly. It becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzo often describe feeling like they're in a fog, disconnected, or just not themselves. And the worst part is when they try to stop, withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug feel essential when